repeat myself, I repeat myself. I'm sorry. This is the part where I repeat myself, I repeat myself, I repeat myself. This is the part where I repeat myself, I repeat myself. Those things he said, those things he did, all piled up on our heads. We swam below the river of it all. We floated so far from where we've been. We floated so far from where we've been. We floated so far from where we've been.
A good Thursday morning to you on this May 6th edition of Real Talk. We've just been having a conversation in studio about Dogecoin. Everybody's paying attention to it. You know, it started off as a joke, as like kind of the crypto equivalent of a penny stock. And then now it's way up and well, like up 60 times. And people are going, wait a second, I thought this was supposed to be a joke. Is it or not? I literally asked the same question to Benny and all the rest of the guys, Graham and, well, you know, Adam from Bitcoin. Well, just the other day, I was like, okay, come on, Dogecoin, what's the deal? If you have questions and you want to go to a source, a trusted source, you can find Bitcoin Well under the sponsors tab on our website, RyanJesperson.com.
Real Talk starts right now. Here's Ryan Jesperson.
So, Sarah Hoyles, did you, in the last 10 minutes, get onto your app, get onto your Shake Pay, and immediately load up on Dogecoin? Did you just drop 30 grand on crypto? Where are you landing on this one?
The jury is still out on it. I'm unsure. I mean, I do enjoy a dog or two.
Yeah.
I mean, they are just. I really, dogs are better than people, frankly. So.
Okay, wait. What are you talking about? Where are you going with this? Take me along on that massive swerve in theme.
Dogecoin.
Okay.
Dog.
Okay.
Therefore.
Okay.
And people suck.
Oh, okay. Where are you at with crypto?
Nowhere.
No, you were
not
just
yet.
Curious about it. It's capturing your attention?
It definitely is capturing my attention. I'm curious about it. I mean, I appreciate the concept of it. I've talked with folks about mining it and how much it takes to actually mine it.
Yeah.
So, I'm fascinated by it, but I'm also very intimidated by it.
A million questions.
1 million.
At least. At least. I love this from Crazy James, who chimes in on our live chat, like right out of the gates. He says, my local hockey team won 13-3 last night. He says, so the play-by-play kept me busy. Everybody's checking in and letting us know exactly what's going on in their neck of the woods. I love this, the live chat every single morning. People just gathering in community. This is great. Wanted to let you know that coming up in a few minutes, we're going to talk to a group of physicians that are participating in a live event on Twitter this evening. It's through Healthcare in Canada, and they're going to be talking about basically COVID-19 perspectives across Canada and the lessons that they've learned. So I'm looking forward to it. We're going to check in with Dr. Naheed Dosani, a palliative care physician, Dr. Hakique Virani, a public health specialist, and Dr. Monika Dutt will join us out of the Atlantic region of Canada. We'll get their different perspectives on what they've learned over the last 14 months or so. I'm not sure we'll have enough time. What have we learned through COVID-19? We could probably talk about that for a week. Maybe we should. That's coming up. We're going to talk to a couple of filmmakers. We've been excited about Northwest Fest. It gets going today, and we've been telling you about Canada's one of Canada's most exciting film festivals, non-fiction film festivals, so to speak, docs. And of course, it's all different this year. Nobody's gathering in, nobody's packing theaters, which is always part of the beauty of a film festival, right? You get to hang out with the filmmakers, and you get to Q&A after it. Oftentimes, you're seeing in some cases, the national or even the international, the world premiere, so to speak. That still is the case with Northwest Fest, but of course, it's all virtual this year. The cool part is it means it's all on demand. So if you can't make Vinyl Nation We're going to be talking to the filmmakers behind that doc today. If you couldn't make it, say, Thursday at 7 when it screens at the theater, you can watch it on demand, which is actually really neat. And right after we sign off the show today, our Patreon supporters, if you check your email, you're going to notice we've got you some special access to Northwest Fest today, so we're excited about that. The Federal Minister of Small Business is going to join us, the Honorable Mary Ng. We're going to talk a bit about that budget and small business recovery and take some of your questions. The best way to get them to us is by using our hashtag RealTalkRJ, or, of course, sending us an email to talk@ryanjesperson.com. And then this was an interesting one. Sarah, you're producing this show, you're putting it together, and Dr. Fiona Matatal, who's as a matter of fact, when you take a look at healthcare professionals that are pretty candid and open on social media, I would say across the country, across Canada, she's one of the higher profile commentators. She's shared with us many of her thoughts, her experiences through the course of this pandemic, and you've booked her. It'll be her Real Talk debut. It's kind of a fun, I mean, there's going to be some seriousness, I'm sure, to the conversation, but it's kind of fun subject matter.
Absolutely. I mean, she's been following along. She's part of the response for COVID. But, you know, it's heavy stuff. And so she's basically said, hey, let's celebrate the helpers. I mean, you mentioned Mr. Rogers saying, you know, in crisis, when you're in difficult times, you look for the helpers. And that's exactly what the doctor is doing. So I'm excited to hear from her how she's celebrating and spotlighting folks that are making a difference.
She's wanting to hand out virtual trophies, so to speak. Pats on the back when we can't pat people on the back.
Virtual high fives.
Yeah, that's right. Brenda chimes in. I was getting some tweets about this yesterday. Brenda says, my granddaughter wants to know where Jespo's eyeglasses are. They're right here. And someone said there was kind of like a mom-son combo on Twitter yesterday asking me about it. And mom is saying, I apologize, I can't remember. Mom says to the little guy, well, he's got contacts in. He doesn't need his glasses because he's got contacts in. Au contraire, contacts are like, I'm trying to think of something I would probably not do. Bungee jump. I would rather bungee jump than deal with contact lenses. I'm scarred. Sam's laughing. Do you have contacts?
I don't know.
Are you like 20/20? You've got pretty good.
I have pretty good vision. My dad got contacts like late in life, and I remember being a kid and he was like wearing them for the first time, and like literally, I don't even remember how old I am, but I do remember like he was having trouble getting them out. And
yes.
He'd look at me like straight up with his eyes and be like, okay, are they still in? And I'd be like, oh, one is still in, Dad. You got the other one out. It's on the floor somewhere.
Or somebody's got it like, oh, my like contact lens is going around the side of my eye. And I'm just like, see, I'm the same. Like, I don't want anything to do with that. People holding this.
Stop it.
Okay, so you don't have contacts, I'm assuming.
No, I don't. Because I don't know if I'd be able to deal.
Yes. No, I cannot deal. I will not deal. I know somebody's going to get in touch right now and say, Ryan,
grow up.
What is there? You're from the 1950s? Contact lenses have changed big time. There's all kinds of different ones, aren't there? People get the daily ones now. It sounds like a commercial. This is not a commercial.
But
and if you are getting daily lenses, why don't you check out? No, but I just, so the reality is I'm kind of getting sick of my glasses. The truth is, Brenda and everybody else that's asking, I don't like the way that they fit on my face when I have headphones on. They bother me. They push up. They've been driving me nuts ever since we started Real Talk. I have a whole bunch of other options back here because, as I told you, I've had eyewear sponsors in past, but they're all old and probably out of style. So I got these ones here, for everybody that's watching us on YouTube, with apologies to the podcast. So
this is great radio.
These aren't bad. These are fine. These are pretty good. These ones are kind of neat, but these are pretty old. You get the flashbacks on Facebook where it's like 10 years ago you were doing. These ones are okay. See, the nice thing is now I realize that Sarah's actually sitting across the table from me, which I didn't realize. Welcome. I didn't realize.
Hi there.
Yeah. Someone says, well, how can you see without your glasses? I can't. I'm looking in the general direction of the camera. You'll notice Sam will switch off. Like, watch this. So Sam will see I have a paper here. And if I'm doing an interview, if I go like this to the paper, then Sam can tell I'm about to read a question. So he'll switch off. Like, he might go to the wide shot like this. But if Sam were to switch back, you would know that I'd be caught because I'd be reading the question. And even here, it's not that good. So thank you for your concern. I suppose what I'm really probably doing is soliciting for an eyewear sponsor again. That's exactly. Hey, once a hustler, always a hustler. So we're going to be talking a lot
At least
of health.
you're honest about
At
it.
least I'm honest. I'm not hiding it. I mean, so we're going to be talking a lot about healthcare today. We're going to be talking about people's COVID-19 experiences. I have a great, lengthy, explorative email about fighting in hockey, which has become a theme through the week, which I'm really actually grateful for, because we're getting really thoughtful responses on it, and some also quick responses. Some people don't need to put much thought into it. They know how they feel about it. It either needs to be gone right away or it needs to stay forever. I'm in the stay forever camp, but I'm happy to have conversations with folks and kind of get into it. Sam, where are we looking? We're all lined up, ready to rock in just a second. Okay,
we got 2 out of 3.
Okay,
ready.
perfect. I'm going to save. Yeah, go ahead.
No, I have a question, because I'm very much on the periphery of hockey.
Yeah.
Like I kind of get bips and bops of hockey stuff.
Basketball's your thing.
Yeah.
Yeah.
If I haven't made that clear yet.
We love it. We're getting to know you. We like when you make things clear. Clarity is good.
Clarity is good. So Tom Wilson, isn't he a hockey player? And he
From the Washington Capitals.
and he, as far as I can tell, he like pummeled.
Yeah, a guy by the name of Artemi Panarin, who's a diminutive Russian superstar for the New York Rangers.
Yeah.
And there was a sort of a mix-up behind the net, and the Capitals and the Rangers are playing, and it just so happened, all the players get tied up, and sometimes like these, you just grab a guy. That's kind of how it goes. And sometimes it works out for you, and sometimes it doesn't. Sometimes you realize you've grabbed Zdeno Chara, who's 6'11" on skates and 260 pounds and just ragdolls people, and you go, oh boy. And then sometimes you wind up with a guy that's like kind of more matched to your size, and it's okay. And most times all you do is grapple and wrestle, and that's kind of what Tom Wilson did. I mean, we don't have the highlights here to show, but anybody that knows that he basically was taking liberties with Panarin, and he was kind of body slamming him a couple times, and Panarin's going to miss some games now. He's reportedly injured. And Tom Wilson, the reason why, and there's a brouhaha last night, because the thing about the schedule now is that all these teams are playing each other back to back to finish the schedule before we head into playoffs. So last night was just an absolute gong show.
Because didn't Gary Bettman, the
commissioner?
Yeah, that's his.
Yeah,
was like meh.
Well, I mean, it's these are very deep questions you're asking. I mean, because
meh?
Well, hockey's in transition in a lot of things, and professional sports is in transition. So, for example, if you want to talk fighting in hockey, you have to talk head injuries. If you talk head injuries, you have to talk science. Which leagues are taking it seriously? The NFL, for example, has already settled a multi-billion-dollar class action suit about CTE and concussions to try to get ahead of it. I'm probably going to be missing details. What we need to do is we'll do a roundtable panel on this, and if you want to call it violence in sport. The word violence is used almost sort of facetiously. I talked to you yesterday about the hockey brand, the lifestyle clothing brand, Violent Gentleman, which kind of summarizes how you might describe hockey culture, how some people might describe hockey culture, Violent Gentleman. Others would have, I'm sure, different descriptions of hockey culture, which is totally fine. But yeah, so getting back to this, the NHL Director of Player Safety is George Peros, who's an Ivy League grad and a smart guy. He's also was one of the most formidable fighters of his era. George Peros, especially when he was in Anaheim, was like he beat the shit out of guys. Like, that's what he did. So a lot of people say, well, look who's kind of making the decisions here on player safety. And then other people say, well, it should be someone that understands the role that physicality, as Brian Burke might say, that truculence plays in pro hockey. So last night, actually, but a really interesting story too last night. There was an inspirational side to it. TJ Oshie of the Washington Capitals just lost his dad, and he's back, and he scored a hat trick, and it was a very emotional night and wonderful and beautiful. And there's this great picture making the rounds on social media showing TJ Oshie and his dad holding the Stanley Cup. And so that's where a lot of people are focusing today. Let's in just a second, we'll get to our physicians. We wanted to remind you that the team at Local Waste tomorrow will be presenting Trash Talk. This is, an opportunity for you to get off your chest whatever you need to get off your chest. Now, you might imagine we've got a lot of emails about rodeos. We've got some emails about lockdown restrictions. I'd love to challenge you, Real Talkers, right now. Shoot me an email at some point today to talk@ryanjesperson.com. Label it Trash Talk, but take a different angle. come at something, infuse a little humor into it. We've been hearing from some audience members that say, it's just been pure anger on Trash Talk lately, which, it's a barometer of where everybody's at. It's not necessarily a bad thing. But I'm looking for some assertion on the positive side. Who can meet the challenge? Find out tomorrow as we wrap up our broadcast with Trash Talk, presented by the team at Local Waste, where integrity is a core value. Also wanted to remind you that the team at Sherwood and St. Albert Dodge are sharing their inventory. They've got double what any other dealership does as you look right now for that new rig to pull your trailer this summer. That's right. It's the season to get outdoors, and for a lot of you, you're realizing that SUV or maybe that half ton you've been using isn't quite enough to pull that fifth wheel. Well, Sherwood and St. Albert Dodge is your one-stop shop. The best selection of Rams in the province, period. The 3-time Motor Trend Truck of the Year. Plus, our friends at the Dairy Queens of Northwest Edmonton and Sherwood Park want to remind you that at their 6 locations and their 6 locations only between now and this weekend, if you mention Jespo or Real Talk, they're going to give you $5 off your Mother's Day cake order. Whether you call ahead to pre-order or whether you walk in and check out the inventory they've got right there, mention my name, mention Real Talk, they'll give you $5 off. Plus, starting tomorrow, a carnation for everybody that picks up a cake. Very cool stuff. All right, this evening at 6 p.m. Mountain, 8 p.m. Eastern time on Twitter Spaces, physicians, healthcare professionals across Canada will gather to share their perspectives, lessons learned through COVID-19. Dr. Naheed Dosani will be there, a palliative care physician, as one of the hosts. Dr. Hakique Virani, a public health specialist out of Edmonton, will be participating on the panel, as will public health physician out of Canada's stunningly beautiful Atlantic region, Dr. Monika Dutt. It's a real pleasure to welcome the three of you to Real Talk. Thanks for making time for us today.
Thanks for having me.
Dr. Virani, we'll open with you. Obviously, when we talk about perspectives or lessons learned through the course of COVID-19, every single person's answer is going to be different. Every single person could probably talk for 12 hours. You've been known across Alberta, and I'm going to say across Canada, for your advocacy and your work when it comes to Canada's opioid crisis. Are there parallel storylines here that you're going to be focusing on tonight in front of this audience?
So there's definitely parallels, and I hope we get a chance to talk about that tonight. There are so many things in common, even though the hazard is different. One is infectious, one is chemical, but I think one of the things that we've learned from both of these, A, is that we don't learn lessons very quickly, but B, is that we cannot manage public health emergencies so long as there continue to exist extreme inequities in our populations that are experienced by groups that we exclude. So whether it's the elderly in long-term care, whether it's people who are living in poverty, people in dense housing, people with no housing at all, or people who use drugs, there are populations of folks that we don't consider as valuable as others. And so long as that's a foundational problem in our society, a structural problem in our society, we will fail every time we have a public health emergency. And I think that's a real learning that we should take home from both of these emergencies. There's some things that are different, though. And one of them is that we have daily pressers for COVID, but we rarely have a press conference on the overdose crisis. And here in Alberta and in many provinces in Canada, there are days that we go with more people dying from overdose than COVID. This is not to compare the two. They're both catastrophes, but it does speak to the problem of inequity and how some people count more than others. I think the other thing that's parallel is that the effects of these public health emergencies on individuals, families, economies, communities are long-standing. When we're past COVID, we're still going to feel COVID. And that's not just because some people have long COVID, it's because the effects of these public health catastrophes go on and on forever. I just read, coming up on Mother's Day, just read a really moving piece from a woman named Tara McGuire about her son Holden, who died from overdose years ago. And her father, unfortunately, also passed away from COVID recently. And there's a sentence in her piece that says, I don't pay as much in income tax as I used to when Holden was alive. I think it speaks to how much this trauma of going through public health catastrophes and losing people to preventable causes of death hurts us as a society. And those are some parallels off the top of my head.
Dr. Dutt, you're joining us from Sydney, Nova Scotia right now, and I know that Canadians, sure, Alberta, Ontario are leading some of the headlines, but Nova Scotia in a bit of a different sense with regards to what strikes me as somebody on the other end of the country as buy-in. I think it was 96 new cases a week or so ago seemed to really ring alarm bells that resonated across your entire province that essentially goes into a meaningful lockdown. Sure, there have been some challenges about vaccine distribution, et cetera, but is Nova Scotia an outlier or a unique jurisdiction with regards to your perspective on how you've seen your home province manage these past 14 months or so?
Yeah, so I have a mix of perspectives. In Nova Scotia, I'm a community member, and I am kind of trying to participate as well as I can and follow the news. I also work in Newfoundland and Labrador in public health. I'm not speaking in that capacity, so I have in some sense, kind of both working inside and outside of different systems, which I think brings an interesting perspective. I really think every jurisdiction in Canada has had, a whole range of different factors that have contributed to, what has happened in those areas and those provinces and territories, and has influenced the decisions. So I won't say there's not anything unique about, Atlantic Canada or Atlantic provinces in terms of how some actions might have been taken and how, some outcomes might have happened. But even right now in Nova Scotia, we are facing a significant outbreak. And again, I'm watching this as a community member and knowing that, just recently we had something similar in Newfoundland and Labrador. And even with, the strictest of, border measures, which you can argue, they work in a lot of ways. They also cause a lot of harm in a lot of ways, but they have been helpful. Were people adhering any more or any less to precautions? We don't have that data to say that, perhaps to some extent. I think geography plays a role. The fact that we don't have some of, say, at least in some places, some of the, living conditions and working conditions that may contribute in other places. I think, like was just said, those inequities, they're across the country, Atlantic Canada, downtown Toronto, everywhere. I think they've played together in different ways in the pandemic, but at the same time with, variants and other aspects of the pandemic now, I think, different provinces are seeing that pressure, and we're all trying to deal with that.
Yeah, some random guy, that's the handle, not what I'm calling him, on our live chat says, I worry about, or rather, there's going to be a lot of collective cultural trauma from COVID, and our kids may be asking us why we still get anxious in crowds or why we keep sanitizing our hands. Scott says, I'm sure that the way that the Great Depression impacted the mentality of people after the 1930s, COVID may do the same for all of us going forward. That's an interesting one. The Great Depression and the 1930s, I've seen a lot of people talking about how the Spanish flu in 1918 led to the Roaring 20s. So I don't know which one to take. Dr. Dosani, you are people talk about physicians and bedside manner. I think, answering a calling as a palliative care physician has got to be one of the biggest. I guess what I'm saying is you have to find a way to ride an emotional roller coaster or insulate yourself from that type of experience. Has COVID been even more taxing on a professional like you?
I think it's been taxing for palliative care health workers, but I think it's been taxing for all health workers across the country. People are thinking about their mortality and death in really unique ways that COVID has put at the forefront. People are working overtime, double shifts, taking on leadership opportunities. We've seen immense grief that health workers have had to experience. We have lost so many of our colleagues, nurses, PSWs who have gotten sick and even died. And, on my Twitter page, I've tried where possible in Ontario to memorialize those that we have lost along the journey. But I think the trauma and the grief that we're going to be dealing with runs along other parallels as well. I think at the beginning, a lot of our political leaders said we were all in this together. And I think at this point, I think that's a really false statement. We were not all in this together. We have seen inequities that existed before COVID get exacerbated. They're much worse now. And we're seeing that on racism and how racialized communities were particularly impacted. We've seen how people experiencing homelessness have been impacted by COVID-19 rates, 20 times more likely to be hospitalized, 10 times more likely to be in ICU, 5 times more likely to die from COVID-19. And we've seen this also on our essential workers who have continued to work in production plants and factories. And in Ontario, a significant proportion of infections continue to happen in these settings. And what we've seen a lot of the time, what we'll be talking about tonight, is how politics were played with people's lives. And in Ontario, we saw an inequitable vaccine rollout. We saw a lack of attention to essential workers. We called for 10 days of paid sick leave. We got 3. And we saw basically a government response that was not compassionate and considering the needs of people. We'll be talking about, how we move forward around compassion, but also why we've seen different responses in different provinces across the country. Why is it that we have the science, we have the evidence, but we saw a different response in Ontario versus Alberta versus Nova Scotia? And should it really be that way? These are questions that really linger for me as I reflect and think about all this.
Me too. I'd be curious to know where all three of you land on this. I was talking to a buddy the other day over text, and he's a really smart guy. He's a political strategist. He's successful most times when he commits to a campaign. And he said to me, one of the things that people seem to forget, for example, talking about Alberta and the fact that cases are sky high in comparison to the rest of Canada, where still there's loud protest, any sort of quasi lockdown. And he said people need to remember that Alberta is full of Albertans. And I kind of thought, well, what's that supposed to mean? Is it like, there's sort of like this freedom type thing, and there is that kind of cowboy mentality to a certain part of the province, but like, does that mean that we ignore science on pandemics or on respiratory diseases? Or I've been having a really hard time wrapping my mind around that, Dr. Dosani, and I don't actually have an answer. I'm kind of just exploring the idea with the three of you right here. How are you wrapping your mind around it?
Well, I mean, it's actually really unfortunate that so much of this pandemic has been dependent on the political decisions of our leaders. In Ontario, we saw a humanitarian catastrophe happen in long-term care. And on Friday night, we saw the Long-Term Care Commission report come in, and it basically showed that no lessons were learned from the first wave to the second wave. There was no accountability on inspections and infection control. And when the province had the opportunity to bring workers together and actually hire them to support them around decent wages, benefits, and paid sick leave, they chose not to, despite the evidence, despite the research. On Friday, April 16th, when cases were skyrocketing, we were talking about field hospitals, ICUs being full. The government of Ontario came out with a response that didn't support helping people, didn't support any interventions that would really help essential workers or racialized people who are getting hit by COVID-19 variants. They announced more policing and enforcement and shutting down outdoor activities and bringing carding back, which actually has no evidence and no research to support pandemics as well. Too much of this pandemic response, at least from an Ontario perspective, because that's where I am and focus a lot of my time, has been ideological. It has been politically driven, and people have gotten sick and died as a result. People may not realize that actually when they identified hotspots in Ontario, the definition of hotspot was not very clear to begin with. And there were communities and areas in Ontario that had low rates of COVID, but were the first to get vaccines, while areas like Scarborough and Peel, which had high rates of COVID-19, didn't get their supply of vaccines. People got sick and died as a result. We will not forget this, and we will be discussing some of that tonight as well.
So, Dr. Dutt, I mean, the title of the event tonight, COVID-19 Perspectives Across Canada, Lessons Learned, that implies typically when somebody in life says, regardless of context, lesson learned, that they're going to change their behavior, or that it's not going to happen again, or that something will be amended or adjusted. Do you believe that that will be the case in Canada? And if so, where would you like to see it, or where do you think it'll be?
To be honest, I don't feel that I can speak for all of Canada. I do feel it's both lessons learned and just a never ending lesson, because I think there's constant learning throughout this. I think what needs to be embedded even more than it ever was before, which, you know, to be honest, hasn't been all that embedded in our often our policies, is how do we address the inequities that exist that have made this pandemic the way that it is and affect the people who have been affected most. I guess in some ways it's a lesson. At the same time, people who are experiencing those disparities, for many, it's not a lesson. It was very well known. People have been talking about this for years and decades. Workers have been, you know, advocating for decent work conditions and paid sick days. And so, you know, to say it's a lesson, I think it's a bit in some ways disingenuous, because it's not a new lesson. It's maybe a lesson for some, but not for many. And so as someone, again, I kind of work in different capacities and different roles. So I think it means both embedding it in kind of in both public health work. And I think, again, public health is much more than just the outbreak piece. It's a significant part of our work. But I think day-to-day public health is also very involved in some of these policy aspects. But I think really crucial is the work of communities and community leaders and organizations and people who are also speaking to these issues that they experience and talking about solutions that they are leading. And we really need to be able to integrate those two better. And I hope that does happen. And I think some changes are happening, but I really think that needs to be much stronger going forward.
Dr. Virani, I think it's probably safe to say that pre-pandemic, the majority of Canadians wouldn't have been 100% familiar with the the role of a chief medical officer of health or what a public health doctor might do. And I know I'm anticipating at least that's going to be part of your conversation tonight at this online event, talking about what chief medical officers of health might have done differently in certain scenarios. You used to be a medical officer of health, so what goes through your mind? First of all, as you're observing people calling out chief medical officers of health, demanding that they do more, demanding that they stand defiantly courageously in the face of political decision makers, that they plant their flag or resign. I mean, you've seen it all. We've heard it all in different jurisdictions across Canada. We saw a lot of fury, partisan fury, I think, leveraged at Dr. Anthony Fauci in the United States. We've seen examples around the world. What goes through your head as a public health doctor when a public health emergency hits, and what observations have you made in this context over this last year or so?
Yeah, I mean, I think first and foremost, this is a lesson of previous public health catastrophes, SARS being one, where we had several commissions after SARS that all individually and independently pointed out that the lack of public health independence in the organization of public health authorities underneath governments is a significant problem when we have public health emergencies that require an emergent response to save lives. There are some commissions have gone so far. In Ontario, Justice Campbell, after SARS, said that during public health emergencies, the powers of the Minister of Health as it relates to managing public health problems need to be removed from the minister and placed in the hands of the Chief Medical Officer of Health. I realize that will be made to be scary by certain flavors of politicians. But if it's not done, the catastrophe that we've seen is how things roll out. And your question was, what do I think of in a public health mind? Where does my head go when we are faced with a public health emergency? And there is a temptation when you've kind of been hostage inside government to think like a politician, because ostensibly that's who your bosses are. But truly, your doctor and your bosses are people, patients. So you think basically like any other doctor, and where your head goes is save lives. That's what we take an oath to do. That's the special obligation that we have to the communities we live in. And when you go through your training, you recognize that it's euphoric to save a life, but it's traumatic when you fail to. And it's especially traumatic because you're about to break the news to somebody who's even far more traumatized than you are. And I think that one thing that every doctor remembers is the first time they had to tell a family that you weren't able to save a life with their loved one. And one of the, I think turning points or moving visuals of this pandemic in Alberta, at least, was, you remember the ICU doctor on his knees in the ICU with his hand in his head, calling a family to let them know that we failed. And as a public health doctor, I think that's where our head should go, is that, when we were coached to have that conversation, we were told two things. Say you're sorry and tell them that you did everything that you could. But in my mind, you only say those things if they're true. You only apologize if you are sorry. And you only say, I did everything I could if you did. And I think that that's where our head should go, is chief medical officers of health, do everything you can so that those preventable deaths in a developed country like ours that should never happen, don't happen. And our aspiration should therefore be eliminate this hazard. And even if we still will have sporadic cases, do not let these things overwhelm a system, grind it to a halt. I think that, that's the reason when we're on 15 months, people are tired. And so they're going to look for people to blame. And it's only natural for folks to look to our public health leaders and think of things that they ought to have done differently.
I know it's going to be a thoughtful and revealing and challenging conversation tonight. It'll be moderated by Dr. Naheed Dosani alongside Leanne Trevors, Dr. Gabriel Stephen, and Sabina Vorha Miller, and our panelists, of course, two of them joining us. We really appreciate it. Dr. Monika Dutt, Dr. Hakique Virani taking time out of their day, alongside Dr. Andrew Morris and Dr. Amy Tan, who's been on Real Talk before, a friend of the show out of British Columbia. You can check it out on Twitter. I've pushed it out by my account, and of course, you can follow these three as well. Thank you so much for this, not just for the interview, not just for the insight, not just for the availability, but for every single step you've taken, the sacrifices you've made, the challenges that I imagine you're keeping internalized right now, like every single other human being walking planet Earth. Thank you, doctors.
Thank you very much.
That's tonight. COVID-19 Perspectives Across Canada. Lessons learned, 5 p.m. Pacific, 8 p.m. Eastern on Twitter Spaces. You can follow HC in Canada on Twitter. That's Healthcare in Canada to find them and to find out more about the event. That's good stuff. Did you track down this photo? Do you remember the first time you saw this photo, Sarah? This is for the benefit of people that are checking us out on YouTube that are watching. This is the ICU doctor that they were referencing. This is unbelievable.
I don't actually remember because I've seen it so many times that it's which is really sad. I
remember the first time I saw it, I felt like I just stared. I was just staring at it. And you're, as you look at it here, you see, like, you're noticing the little things. The fact the doctor is on his knees as he's calling a family to say they lost the patient. The fact that his head is buried in his hand. Just the exhaustion. You could just see. Look at the bins in the back. The recycling. Everything's piling up. It's just everything. There's so many metaphors in that photo. Just an unbelievable capture. Is there a photo caption on that? I always love to shout out whoever it is that grabbed it. I think it was a former photographer, I think, that I worked, if I remember correctly. I'm racking my brain trying to remember who it was, but we'll give them credit.
But it was Alberta Health Services.
Alberta Health Services
actually tweeted it out originally.
Yeah, that's right. It was a photojournalist commissioned working by Alberta Health Services. I'm sure that somebody's going to nail that for us and let us know. We'll give them a shout out when we can.
I will retweet it right now.
Yeah, that'll be great.
So people can check out my Twitter if they're listening to this later.
Linda Ray says it's so good to listen to experts who appreciate, or Linda Ray maybe will say who accept, the premise of the questions. Others are saying, awesome panel, that was great. Some random guy says, yeah, looking at that, I never really noticed the doctor was on his knees in that photo.
I had never really
ordinary
noticed
day.
that.
Really? Is that right?
Yeah, that was first for me. Is like you just pointed that out. I was like, I didn't realize he was on his knees. I've seen that photo so many times.
Yeah, and it says so much more, right? When you're on your knee, it just implies so much more. It says so much more about maybe where your state is at, or the fact you need to take a knee, as we say, or maybe the exhaustion, or maybe just how do you I think about this with police officers as well, going to knock on the door to inform someone that there's been a horrific accident or that something's happened, and they're not expecting you knocking on their door, right? Like out of nowhere, you knock on someone knocks on your door and you look and you see that it's a police officer right away. You're kind of like, you know what I mean?
Yeah.
Like, what's up kind of thing. You open it and then all of a sudden, are you this person? Yes.
Yeah.
There's been an accident. Like, I just can't imagine what police officers carry with them on some of those notifications they've had to give. I guess, you know what? I just bring these up not to discourage people. I bring it up so we can tell people we appreciate them, so we can reflect on things. Like, just walk through life and You know what I mean? Like, not everybody's always happy to see cops. People, I don't know how this is turning into a conversation of policing as opposed to healthcare, but it's a reality, and everybody's been dealing with
I mean, paramedics
COVID-19.
also.
Paramedics 100%. I mean, so many people.
Yeah.
Right? I mean, anytime you're even going to talk about first responders and safety, people are going to write in, and as they should, and say, why has no one mentioned tow truck drivers? Tow truck drivers have like one of the most dangerous jobs in the world. 100%. Right? We don't think of, like, what about letter carriers? What about the people that have been working at FedEx and UPS and in the Amazon delivery warehouses? And now someone's going to call me the enemy of small business, which is a great segue to mention that the federal minister of small business is joining us in about 21 minutes time. But
pro.
people have just been running and serving and giving and sacrificing through the course of this pandemic. But, it's just, I don't know. I just wanted to say, to wrap up that thought, not everybody's always happy to see the police. I get it. And in many cases for very good reason.
Yeah.
There are problems with institutional racism and systemic racism and all these types of things and carding. And we have these meaningful conversations. We're not afraid of them. At the same time, we can be grateful that people show up in law enforcement every single day to maintain some semblance of safety and do the important job that they do. And it's always interesting for me as a dad. I'm a father of a 5-year-old, and it's very different. Like when a kid sees a police officer, right? It's very different. It's the like, hey!
Same with the garbage
right?
man.
And then the cops like whoop whoop and like light the SUV up, and the kid gets so excited and all this. And I brought this up on the show a few weeks ago, and we got some really thoughtful emails and comments from people that are like, boy, when they drive through my neighborhood, it's a bit of a different reality on both sides of the equation, right? Mm-hmm. Yeah, stuff to think about. We try to walk miles and miles in so many pairs of shoes every week here on Real Talk, and we promise you we're going to keep doing that. I wanted to remind you that the team at Eden Landscaping, this is the time of year. They've been chomping at the bit for the last couple of months. They've been meeting with their clients on Zoom. They've been taking a look at your photos and your Pinterest boards and all the Instagram posts that you've been saving. And Mike and his team have been using that to come up with plans, the blueprints, if you will, for dream spaces outdoors. If you've been spending all winter staring into your yard, now's the time for a new deck, maybe, or an entertaining space, or what about flower beds or a fire table? These fire tables are amazing.
But don't get me started on fire tables.
Oh, buddy, fire tables are the new
They're
fire
so
pits.
Cool. Yeah.
Veggie garden boxes, shrubbery. Eden Landscaping is the go-to from start to finish, making your dream a reality. You can check them out online at landscapeedmonton.ca. Our friends at Friesen Brothers want to remind you that they have these amazing Mother's Day picnic boxes available for the first time. This is the first time they're ever doing them. Check these out. I mean, this is like charcuterie times 10. Does that even make sense? I was trying to come up with how do you say charcuterie times 10 en français, but I can't remember how you say times. How do you say times? Anybody remember how you say times? Yeah. I know that our Francophone audience members will just right now be going, oh my goodness. Oh, it's been a while. This is how you really ramp up your Mother's Day celebration. Here's the deal, though. They're only doing it out of their Edmonton, Fort Saskatchewan, and Stony Plain stores. You can order them in advance. Ahead of time, they'll be made up specially for you to hit on the priority items, the ones that Mom's really going to love. Limited quantities available, so you've got to make sure you book as early as possible. The booking closes tomorrow morning for pickup on Sunday at the Friesen Brothers stores in Edmonton, Fort Saskatchewan, and Stony Plain. We're also very excited here at Real Talk to be the title sponsor of the Global Visions film series at this year's Northwest Fest International Documentary Festival. As mentioned earlier, it's not happening in theaters, so to speak, but the show is going on. They've got an outstanding lineup that you can check out, all available online and on demand. 40 feature films, 40 short films. Anybody can catch them starting today, May 6th, all the way through to May 16th. It's the only festival in Alberta where you're going to see docs like Vinyl Nation. Before we check in with the filmmakers, let's take a look. This is an excerpt. It's an expert excerpt from Vinyl Nation.
Vinyl can really help you with parenting in that being able to talk about music, hear music, and tell a story about an album or a period of time. It gives you really nice inroads. And I think when you're physically connecting, when you're touching something, it forges more connection for you because you pause and you're talking to each other and you're listening to each other in a different way. Sunday vinyl is a family tradition. So I get up in the morning and I play whatever the week has been. And then at dinner time, I play a few records that are gonna take us into our next week. If it's a blues record, folk music, or a jazz record, I'm giving something to them. We have this day together and we have this time together, and it's our version of church.
There you have it from Vinyl Nation, screening on demand at Northwest Fest. We're thrilled to have Kevin Smokler, Christopher Boone, the filmmakers behind this doc, joining us live. Welcome to the show, fellas. This is
thanks for having us.
I watched like 45 seconds of it, and my face is just smiling so big it hurts already. People have there's something. I mean, people connect to music, but then people connect to this format, to vinyl, unlike anything else. How come?
This is Kevin. We like to say that a vinyl record activates 4 of the 5 human senses. You can see it, you can hear it, you can smell it, and you can, Chris, what am I missing? Touch it. You can taste it if you want, but we'd recommend you don't. It is a more complete, immersive way of having a relationship with music. And of course, we can talk about cover art, and we can talk about how much fun it is to go to record stores. But I know we only have a limited amount of time. But the benefits of vinyl could keep us here all afternoon.
Well, I'm going to tell you, fellas, the show kind of like goes however we want it to go, and that includes the guests. I mean, you guys are filmmakers. Let me just say, you can direct this as much as you like. So feel free to explore different thoughts. Christopher, have you always been? There's almost like I don't think you say it's a cult following, because it's a little bit more mainstream than cult, but I think back to like John Cusack and High Fidelity, and there's a whole culture around it. Have you been part of this, or did you dive in when you started making the film?
No, I think I got back into records probably around 2014. My wife and I got our first turntable, but Kevin was the one who had the initial idea and brought it to me, because he's a writer and I'm a filmmaker, and we know each other way back from college days. But I was really interested in this because my daughter got her first turntable when she was 13, and she never owned music in any sort of physical format until she got a turntable. You know, she went straight from iTunes and Spotify to records. And I was just fascinated to learn more about this younger generation that's getting into records. You know, why is that? And people like myself and my wife who, you know, wouldn't really think of ourselves as record people because we were just a little too young, like the first time around. And yet I realized I was getting disconnected with music when I listened to it through streaming. So records is a way to reconnect with that, and just realizing there were a lot of people like myself out there that were getting back into records. So Kevin and I really just want to explore like who are all these different people that are coming back to records, or have discovered them for the first time, or have been into records ever since, you know, they were young people.
Okay, so I got to show you guys this, and with apologies to everybody that's listening to the podcast and not watching us live on YouTube, but check out this photo. This is from Yuri. He tweets at Enigma Machine. The producer of this show, Sarah Hoyles, asked, "What's your favorite record? What's your favorite, you know, piece of your vinyl collection leading into?" And he goes, "Just one. I'm out." And he's just, this is a flex. If I've ever seen a flex, this is a flex. I mean, when it comes to vinyl, there's just something about it. I love that you invoked digital music and streaming music, because while we see a resurgence in vinyl, Kevin, it is amid some of the most impressive technology we've ever seen that really, in theory, would negate the need for vinyl. So there's got to be something more to it. What is it? What did you find out in making the film?
Isn't that crazy that vinyl comes along at the exact same time? The vinyl resurgence comes along at the exact same time streaming comes along. And we make a point in the movie Vinyl Nation that streaming and vinyl work really well together. Chris and I like to say that streaming is just a taste of the drug before you commit to buying the whole kilo, and the whole kilo is vinyl. And you get to audition things and try things out on streaming for $9.99 a month. And then you can determine if you want to go whole hog with any of those and buy them on vinyl. Thanks to the comeback of vinyl ain't cheap anymore. I mean, it is if you want to buy something used, or you're really into like 80s schlocky Canadian prog rock like I am. But if you want to buy a brand new piece of vinyl, it's you know, 20, 30, 40 bucks. And if you want to do that several times a week, like most of us do, streaming is a good way to make sure that you don't go bankrupt pursuing this wonderful hobby.
So this is, yeah, I mean, it's kind of funny because I've had friends that, we say music snobs, but we say it out of love. It's actually something you aspire to be, I think. But one of the things I was talking to a buddy a while ago, he's super choked because now with streaming and you can just sign up for like Spotify or Apple Music or whatever. And he's choked because he used to be so proud of his collection. Like he had albums that nobody else had. And there is still an element to that, of course, but he doesn't like that everybody can just go to browse or suggested playlists. He used to be the guy that would burn us the CD once a year. He was the guy that introduced us to all the bands. He was the guy that knew about everybody before everybody else knew about them, right? Does vinyl, Christopher, does it preserve that space, that play space for the music snobs? What did you learn about the people you talked to when you put the film together?
I mean, we really learned that vinyl records are for everyone. But I mean, if you're really into your records, there's some music that's only available on vinyl records. Like, so those collectors may have the only edition, the only way you can hear that music, because that was the only way it was ever put out. It was never put out on cassette. It was never put out on CD. And it definitely isn't on streaming right now. So to think that, I think there's this fallacy that we believe everything is available on demand because everything we think is streaming. And that's just not true. It's really just a fraction of the music that's ever been produced that is actually available on streaming. We've just been led to believe that it's all out there. And so those people who are just hardcore collectors, there's definitely still a space for them. Like in Vinyl Nation, we visit the Austin Record Collection, and it is just this huge, massive record show in Austin, the biggest one in the Americas. And you get people from all over the world that travel to it to look for records. But what's really cool about it is over the past few years is it used to just be like real hardcore record collectors that went there. But now it is everybody. It's young, it's old, it's every race, it's every gender, it's parents with their kids. And pretty much any record you're looking for, you're probably going to find it there if it's really rare or if it's brand new. And you can get into a ton of really excellent conversations with people to learn about music you've just never discovered yet.
I've got a text here from Brinley that says these guys are buying kilos at a time when they party with these two. Kilos?
Well, thank you, Brinley. We appreciate you thinking we're way cooler than we actually are.
That's right. Yeah, I think it's like pretty much it's cartels dealing in kilos. But hey, who can blame an enthusiastic reveler, especially after being locked up in isolation for the last 14 months, right? So what did you? So when you're putting this film together, Kevin, like who did you? First of all, you line these people up. I love that clip that you provided to us. It's absolutely beautiful. You know what I even loved is like, what do you call the dust thing? Like she's like clean, getting the dust off the. I mean, there's such a stewardship to it. There's such a care of it. You don't see people like with finding how people with CDs, you sort of like in passenger seat of the car, you just you're just kind of throwing them around. They're banging. They're up in the visor, the sun visor jammed in there. You did that to somebody's record? Like, are you kidding me? Like, so what did you learn about who's collecting vinyl? And I would imagine you meet people of all ages, all backgrounds, socioeconomic and otherwise.
We certainly did. And when Chris and I started talking about doing Vinyl Nation together, we were like, okay, if records have experienced a renaissance, it probably means that more and different kind of people are interested in records than we once thought. And listen, if it's just the two of us and we're going to be making a movie about 40 people who look like the two of us and sound like the two of us, that's going to be really boring. And we don't have much of a story there. So in our initial exploration, we were like, okay, let us find every possible different kind of person, race, we like to say race, gender, creed, hometown, and musical taste that would be interested in records. And let's hear their stories, because we really backed ourselves into a corner choosing a pretentious title like Vinyl Nation. And a nation is a big, diverse thing. We hope we accomplish that in the movie. We'll leave that for the audience of Northwest Fest to determine.
I know people are going to be excited about it. I love that you invoked the word nation.